So now we have come to the segment in the MD observed history taking. So I will just go through how we conduct this exam. As you all know, it carries, you need to take minimum of 40% to pass this component of the MD, okay? So now what happens during the exam and what happens, how we create the exam case scenario, I'll briefly describe in view of the time concerns. So the panel of examiners will form a case scenario based on the usual common clinical problems we encounter in the wards or our clinical practice. So based on that, we will work on the case scenario, build up it, and that case scenario will be scrutinized and calibrated by the panel of examiners. And the surrogate is well trained and will have many practices before we conduct the exam to make sure that the history is given very well, and it happens usually very well, even better than the usual patients. So I will go through how the timing happens in the observed history taking. Due to the time concern, I have given already the candidate document to the doctor who is going to be the candidate today. So usually we have 5 minutes for the candidate to read the candidate's document, that means the main clinical problem. So the candidate will be seated outside the examination hall and will have 5 minutes to, based on the clinical problem, he should be able to prepare what he is going to ask, and he can make an overall idea about that. Okay. So after the end of 5 minutes, the candidate will enter the examination hall, and he has 14 minutes to spend with the surrogate. Okay? So he has to go through usual the history taking. So at the end of 12 minutes, one of the examiner can give a clue that the 2 more minutes remaining to complete his history. Otherwise, he may not be very sure when he will be finishing. Okay? So by the end of 14 minutes, the surrogate will leave the examination hall, and 1 more minute is given to the candidate to recollect his or her thoughts. Okay? And the next 5 minutes will be spent with the examiner. Usually one examiner will take the lead role and question the candidate. So the total encounter will be 20 minutes within the examination hall. And both the other examiner will be observing, or sometimes they may ask the questions also. Both examiners will mark independently. Okay, so that is the setup of the observed history taking. Usually these are common medical problems, so nothing very unusual that we take for these clinical scenario. So I will show today's case, so you all can go through, and the candidate today who is going to demonstrate this live station, it has been already given this document, and I hope he is ready with the document, so we can directly start with the observed history taking.
Good morning.
Good morning, Doctor.
I'm Dr. Brinavan, registrar in this medical unit. I got, is it Ms. Gayani Pereira?
Yes, Doctor.
Okay, is it okay if I talk to you right now?
Yeah, sure.
Regarding LS? Okay. So, can you tell me about your age and where are you from?
I live close by. I'm 25 years old.
Okay, so, you are married?
No, not yet.
You're working?
I'm working as a secretary in a private company.
Okay. So, are you suffering from any long-term illnesses?
No, doctor. No.
Okay. So you're not following any clinic, and you don't take long-term medications, routine medications.
On and off, I have like a joint pain in the knee, so sometimes I take some painkillers for that.
Okay. So can you tell me regarding your problem? What is your illness?
So I've been having diarrhea for about a month now. Like it's mixed with blood and mucus. So yeah, it's been going on for about a month.
Okay, so before 1 month, you are perfectly okay, almost normal.
Yeah, I was. normal,
Okay,
yeah.
so it's all started 1 month back. So can you tell me how it is progressed throughout this 1 month duration?
So it's like I pass those like 4 to 6 times a day, and sometimes about 2 or 3 times a night as well.
Okay, so that is the same whether it is worsening or is it progressively static?
It's sort of the same, but
Same
it's
for
been
the
going on
1
for
month
about a
duration.
month. Yeah.
Okay, so can you tell me about the consistency of the stool, whether it is a semi-solid like a watery?
Sort of watery, but with mucus and blood. Not
Okay.
all stools though.
Okay, so whether it is with each episode, whether it is a large amount or whether it is a small amount you will
It's
be
like
passing?
like a normal, can't say it's a large amount, like an average sort.
Okay, so you told that it is associated with blood and mucus. So whether it is blood is like a streak or whether it is mixed with the stool?
It's sort of mixed with the stool, but not all stool. Sometimes it's normal also.
Okay, so can you tell me about the color of the stool that you are getting a tarry color stool or whether it is a dark brown?
Sort like maybe like a dark brown. It's normal, not colored out.
No,
Yeah.
okay. So, okay, so you had these episodes during the night also. So, with these, do you think how is your appetite these days?
I feel like I've lost my appetite a little bit.
Okay, with the
Compared
reducing appetite. So, whether do you think that this low stools is the frequency and the severity is improving?
No, it's the same.
Have you tried to cut down the food to see whether it is improving with fasting?
No, I have not tried that.
Okay. Do you think these diarrheal loose stools episodes are more related to your meals?
I don't think so now because it's been going on for about a month now, so I don't think it's related to meals.
Okay. Other than the loose stools, do you have any other problems?
Like,
Do you have any abdominal pain associated?
yeah, sometimes I have like a pain before going to the washroom. I have like a tummy pain.
Okay. That abdominal pain, can you specifically tell where is the abdominal pain is?
Sort of like, not like very lower, but then sort of in the middle.
Okay. So it is episodic or it's a continuous pain?
Usually before going to the washroom, I get a pain in the stomach.
Okay. So it will be lasting for how many minutes, or is it per hours?
No, not that long. Maybe like after I come out from the washroom, it sort of reduces a bit.
It will be improving. Okay. So, okay. So, do you have any fever associated or chills?
No fever.
Okay. So, do you think that there is a change in weight during this 1 month duration?
Yes, because I feel like I lost my appetite a bit as well. So I feel like I lost a little bit, but I've not checked my weight recently, so I don't know like the
Okay.
amount.
So, okay. So, do you feel? Did you notice that there is an increased sweating during this 1 month duration?
No, I have noticed.
No.
No.
Okay. So, you told that there is a increased frequency for during these days. So, is it in between the episodes? Do you get this difficulty in passing the stool, or like a constipation? Like it's
No, doctor.
no. Okay. So, whether after passing the stool, do you get the painful urge to defecate immediately after the
No,
passing?
no.
So you told it's a normal stool and sometimes it's a watery stool. So do you get the bulky appearance, whether it is like a pale, bulky appearance that is stools that is difficult to flush?
No, I haven't noticed.
Okay. Have you noticed any ankle swelling these days?
No.
Okay. Did you get severe fatigue and it is you get this shortness of breath when you're walking or when you're exerting, or whether you get the palpitations these days?
No, I only feel more tired than usual.
Okay. And so, do you feel that it is unable to get down from the bed or sometimes unable to walk?
No, doctor.
Do you get any numbness associated? Okay. So, is it difficult to climb the stairs, or whether it is difficult to get up from the squatting position?
No, doctor.
Any other bleeding manifestation other than this stool, blood with the stool?
No, nothing. Other than that.
Okay, so so you told this is. Have you had any previous episodes like this?
Yes, actually, 2 years ago also I had a similar like a sort of episode, and also 6 months back. But then it settled on its own after about a week. It settled on its own, so I didn't take any like proper medication or anything.
Okay, can you tell me about the episodes in the 2 years and 6 months back?
Something similar to this.
Similar. How
Yeah.
long it was there?
For about a week,
For a week. That
Yeah.
is 2 years back also you had this episode, and again
6 months ago.
6 months ago.
Yeah.
So that is also associated with blood?
Yes, something similar, but I didn't like go to like do any tests or anything. So it sort of in about a week it just went away on its own.
Okay, have you taken any medications or any treatment?
For this episode,
No,
no,
for the previous episode?
no.
Okay. For that, both episodes, you didn't take any
No.
medications. So during those episodes or during this episode, have you ever felt there's joint pain associated?
I usually have like a knee pain, which
Okay.
I take painkillers for. That is on and off, not a regular one.
Can you specifically tell where is it only the knee or where else also you are getting this
No,
pain?
just the knee, doctor.
It's bilateral, or is it both the side?
Yeah, sometimes it's a like usual thing. On and off, I get the pain, so I take some painkillers. It goes
When
away.
you get the joint pain, whether it is during the night or in the morning, or is it continuous throughout the night, throughout the day?
I haven't noticed it that way because it doesn't last that long. So it's usually like maybe like the daytime.
Do you feel that there's a stiffness in the morning with this joint pain?
No, I haven't noticed.
Okay. Any other joints in the hand also? Do you get that?
No, just the knee.
Okay. Do you get any eye problems?
No, doctor.
You don't have a red eye or anything?
No,
okay.
nothing.
So no visual problems?
No.
Okay. With this joint pain, do you get the back pain also?
No, doctor. Just the knee pain.
It's no buttock pain or back pain associated. It's only the knee pain.
Yes.
Okay. So any skin, whether you have any rashes or whether you have any ulcers throughout these last 2 years or before that?
No, doctor, no.
Okay. So, have you ever treated for chronic cough, or you had treated for tuberculosis? We call it as TB.
No, doctor, no.
Okay. Do you know anyone who have a history of chronic cough, or whether he was treated for TB recently?
History as in from the family?
Yeah, for the family or relatives.
No, but one of my uncles passed away 2 years ago, but he had a cancer in the colon, so that was but nothing of TB or anything.
Okay. What is his age during the when he was passing?
I'm not very sure of that. He probably would be about 60 or something, but I'm not sure.
Okay. Okay. So, do you have you had any surgery throughout your
About a
history of
year,
surgery?
yeah, a year ago, I think there was in my back passage there was like a pus discharge, so there was a minor surgery there, but then that went well. That was, I didn't have any issues afterwards.
Okay. So you had this the discharge, pus discharge, or like
Yeah,
pain during this one. So that is, when is that one?
about a year ago.
So is it related to the previous episode?
No, I don't think so.
Okay. So are you on any medications for that? Are you taking any?
No,
drugs
no,
for that?
no.
Okay. Do you have any allergic history?
No, doctor.
No, not for the food or drugs?
No, no.
Okay. So how is your diet? You are taking normal diet?
Yeah, normal.
Okay. You are taking all 3 meals and.
Yeah,
Okay. So it is adequate with your non-vegetarian or vegetarian?
I'm not a vegetarian.
Okay. Have you ever traveled to travel other than from your hometown?
Not recently, no.
Okay. So, so how is your menstruation like?
It's
Whether
normal,
it's
doctor.
normal.
Yeah.
So it comes every. So every monthly you are getting the
Yes.
periods. So do you have any significant pain or whether it's significant bleeding associated with it?
No, it's a normal, normal cramps
So
and
when
all.
is your last menstruation?
About 2-3 weeks ago. Yeah.
Okay. So so this is for the relevant for the this presentation and for my further diagnosis person. So I want to ask further questions. Have you had any unprotected sex during?
No, doctor.
Okay. So have you ever consumed alcohol or smoking?
No, I don't.
Okay. Can you tell me?
You have 2 more minutes.
Okay. Can you tell me about your family and your?
I have one sister. My parents they are still alive. I mean, they are quite healthy and they are okay. The only episode was my uncle passing away about 2 years ago. So that is why I'm a bit worried with this pain that I have.
Okay. So, so what do you think about the illness?
I'm not too sure, but I feel like it's something like my uncle had because he died of cancer, like I said. So I'm a bit worried about that also. So I'm not exactly sure, but it's been going on for a month, so I'm a little concerned.
Can understand this one. So, okay. So, what do you expect from the medical team regarding the illness?
If you can do some maybe like blood test or something and get me like a proper, I need like a proper permanent treatment. So
That's true. Yeah.
because one other doctor, someone I knew, he asked me to get an endoscopy done, and I don't want to. I'm sort of a bit like nervous about it, so I don't want to go there. So if you can do some tests and give me some medication.
So, Ms. Gayani, it's more towards a longer duration of diarrhea, and as it is a blood, we want to go for the some basic investigation. We have to go for blood workup and to see whether and also the stool reports. With that test, we may have to go for the endoscopy. That is after the investigations only we can decide. So we'll be telling regarding the importance of the endoscopy. What we mean by endoscopy is that we'll be inserting a tube through this one and to see how is the appearance inside and to take the biopsy. And we have a proper preparation plan for that one, and it's with the anesthetic medication. So it will be okay.
Thank you, doctor.
Thank you very much. Thank you.
You have a minute to recollect your.
Good morning, sir.
Right. Can you summarize your case?
Yeah. My patient is Ms. Gayani Pereira, who is a 25-year-old woman with she's with remitting and relapsing chronic diarrhea, and this time coming with a moderate to severe intensity of diarrhea, which is associated with blood and mucus. So, which is associated with more towards oligoarthritis or polyarthritis, and also which is associated with the anal symptoms, that is more towards the anal fistula associated. with the significant concern of family, that is his uncle had a carcinoma. So here it is more towards an inflammatory type of diarrhea, which is a remitting and relapsing type without significant malabsorption component.
Right. What is your most likely diagnosis?
I like to, one is an inflammatory bowel disease, and in that I will go for more towards a Crohn's disease in this patient.
You think it's more like a Crohn's disease?
Yes.
Why not the ulcerative colitis?
Though it is, even the Crohn's colitis, the blood and mucus is more towards ulcerative colitis. You can get the blood and mucus with the Crohn's colitis also, but the anal symptoms and the anal the symptoms are more profound and more a hard sign for the Crohn's disease. Though there is no significant malabsorption symptom, malabsorption is associated. It is associated with significant constitutional symptoms and abdominal pain.
So apart from this inflammatory bowel disease, any other differential diagnosis you can entertain?
Yes, according to the age, she is 25 years. So I want to consider any infective causes like especially TB colitis, and other one because of the past histories, she refused that not on any antibiotics. Still, I will suspect a pseudomembranous colitis, and during my initial investigation, I will rule out pseudomembranous colitis. Another one is thinking about the age, malignancy, especially lymphoproliferative diseases. Also, I will take into account.
Right. So now this patient has concern. Now she doesn't want to go for an endoscopy.
Yes.
So how can you confirm the diagnosis?
I will try to convince the patient to go for the endoscopy. If not, I will do the basic blood investigation, and then I will go for the MRI, including the endoscopy and this. So that is. So I'll go for the imaging if she is fully refusing, but I'll tell the importance of this endoscopy and to see the biopsy, especially I want to do the histology and the cultures, and to see macroscopically and the histology microscopically to differentiate my differential diagnosis.
Now, has she developed any complications of inflammatory bowel disease according to history? Did you ask for that, any complications? What are the possible complications of inflammatory bowel disease?
So there is one is it's in the first 10 years they can have this, if it is a Crohn's, they can have this fistula and they can have this abscess associated, and also they can have a sepsis, and there will be fistula to the organs and to the cutaneous surfaces, and also they will be having anorectal symptoms, especially the anal fistula, and abscesses is also possible. Other one is they can have the fulminant colitis, where they can have a megacolon, and if it is a long term, there is a possibility of malignancy associated with ulcerative colitis than the Crohn's disease.
If it is ulcerative colitis, how do you treat the patient?
So I will go.
Thank you, Dr. Pranavan. So let us go through the important points that you all have to get in this patient's history. Before going to the salient points, I'll take you all through what is expected from a good candidate. So these are the important areas. I think Dr. Pranavan was able to elicit all these components in the history. So this patient had blood and mucus diarrhea for a month with the two similar past events and associated loss of appetite and loss of weight. Patient had a history suggestive of a perianal discharge according to her description. There is a history of intermittent knee pain requiring analgesics as needed, and there is a concern about a colonic malignancy in patient's maternal uncle. And patient is worried about having an endoscopy, and she is really scared about having it, though it was suggested by one of the doctor in the past. So the candidate should have been able to get all these information in the history and able to present in the summary to the examiner. And the other possibilities now, as he discussed, the possibility of an inflammatory bowel disease and the Crohn's disease is likely, with the other less possible causes, as Dr. Branavan discussed, is important to be brought out in the discussion. And also the worry about the endoscopy as well as the malignancy needs to be discussed during the discussion part. Now, what is a good candidate is expected to take during this observed history taking. As you all know, the candidate should be able to commence the consultation very well and should be able to establish a rapport to take a complete, relevant and appropriate history covering all the main areas in the history. You should not miss any component in the history, like this patient has a significant family history or a drug history. All the components needs to be included during your history taking. And the questions, you should be able to give different types of questions, either open-ended, sometimes it needs to be close-ended or a direct questions. As appropriate to the patient's scenario, you need to use the different types of questions. And the main symptom needs to be analyzed appropriately. In this patient is the blood and mucus diarrhea. Patient has clearly said. So I would say, rather than asking about the chronic disease initially, you can go towards the initial symptom, because the history is in a young female having a blood and mucus diarrhea for a month. You can start with that and you can go back and ask about the chronic diseases, because you initially started with the chronic disease, whether you have something, and then went with that. Of course, it is a good way to start sometimes to get a good rapport with the patient. But in this patient, after taking the initial information, you can go directly to the history and work on and analyze the history. You need to have a habit of listening very well, not to interrupt when they are giving or describing the history. Use simple language, okay? And you need to elicit surrogate's own ideas, concerns, and expectation regarding the illness. That is how you need to manage the time very well, because you always keep this for the end, because unless you know the whole history, you will not be able to elicit this. So you need to time it in a way, that is why we give that 2 minutes alarm, and you need to explore these patients' ideas, concerns, and expectation, and you need to address on that in your discussion. And you should be able to come to a reasonable conclusion or a differential diagnosis, sometimes to a diagnosis as well. And this consultation should be done in a professional way, in a very confident, fluent, and a human manner. And always make sure that it is expected that you should not use any medical terms that the patient cannot understand. So that's all expected from a good candidate. I hope this demonstration is useful for all the trainees who have been there. We have taken a very simple case so that it will go on smoothly. And let me thank our surrogate for her kind cooperation and agreeing for this observed history taking. Thank you very much. Thank you, Dr. Branavan, for being a candidate to demonstrate today. And thank you, Dr. Udayaralapanava, my co-examiner. Thank you.